are the efforts being made by either the county or state leadership? What's being laid on the ground? We're going to talk about, infections rate as well as release rates, and then, what kind of resource they present to folks that's being released, or what are you doing for people to get released? Then we're going to open up the lens a little bit and start talking about state and regional, because we want to kind of contrast what's being done on the ground and what's being done by elected officials and how it directly impacts us. For instance, we all know that a lot of those jobs that are being lost are being held by people who look like us, who come from where we come from. So we want to talk about that. We want to talk about, if you feel able to talk about it, this relief package doesn't even include people with a record. So if you're a small business owner, whether nonprofit or entrepreneurship endeavor, you don't even qualify for any of these relief funds that they're putting out. So we want to talk about that. And then we want to talk about, like, what's our plan going forward? How do we recover as a community that's directly impacted? How do we save ourselves? What do we need to be put in place idealistically, but also realistically? Because we know none of us are sitting on $100 million endowments. So who do we need to bring into the equation, hold accountable, access resources from, and just partner with? So I know that's a lot in a short amount of time, but trust me, once we start talking and moving, it's going to be pretty quick. What I'm going to ask you to do is, when you're not speaking, to keep your mic muted. I'm going to try to manage this chat. So if you got something, a question or something to be raised, please feel free to put it in the chat. There's also a button down there that you could raise your hand. But if all else fails, just raise your hand so we can visually see you, so that we don't end up talking over each other or interrupting each other, because I know that everybody on here has something important to say. We want to make sure that people hear it. And then, hopefully everybody shared it to their networks, on their website, on their social media, and we'll get a bunch of people tuned in watching. I believe you recording it, right? Dave, I don't know if Dave is on, if he can hear us.
Yeah.
Okay, are we recording this?
Yeah.
So you'll be able to access it later. We're going to go live in about, what, 2 minutes, David?
Yeah, whenever you're ready.
Is it possible to reinstate the question, like when you get to maybe the fifth or sixth person? Is it possible to reinstate the question in case we forget?
Yep. Any other questions anybody have before we get ready to go live? And remember, it's live, so don't be hard on yourself. If you make a mistake or you forget something, we can always come back and have you, reiterate or clear up whatever. But at the end of the day, we want to capture your live energy and your expertise. And remember, this is a panel full of formerly incarcerated people, and we talking to the world about what our specific concerns are around this COVID pandemic and how how everything is playing out. All right. So we got about 1 more minute before we go live. I'm gonna try to slow down.
Oh, I thought we had 3. I thought we still had 2 minutes. Okay, I'm sorry.
We got about 1. But if you need 2 minutes, we can take 2 minutes. So we ain't gonna be, that much of a stickler for that. If the ladies need to do some lipstick or something, or use a bathroom or something.
Yeah,
you got time.
Just want to use the restroom.
All right, so we'll take a couple minutes and let you get situated. Give us a ping when you get back. Brothers, if you want to do the same, now's the opportunity. Any questions? Cool.
No, go to the
Cool.
next
Good to see everybody here. Ready, Dave, to go live?
Yep, ready.
All right, because I see we right at a couple minutes after. We're trying to do a lot of things at the same time. So somebody just said the Facebook is private. It's not coming up on the website.
Mm-hmm.
It's live now. It's live on the website. We good.
Okay, we good. So let me know. All right. So y'all ready to go? I'm waiting for Vidal. He should be joining us short. They finishing up that the Twitter chat. Dave, you know if Vidal is ready or not?
He said he's having trouble signing in. I'm trying to get him in now.
Okay, let's take a minute to get Vidal in.
Hey.
Yeah. Right.
Hey, what's going on, Ruben? I just got in. Thank God.
Okay.
Yeah. How you
We're
doing,
ready to go
everyone?
live now, man. I'm glad you was able to make it.
Yeah.
So we're gonna start with a quick introduction to everybody, then we're gonna jump into dialogue. All right, you ready to go, Dave? Whenever you're ready, David.
Yeah, we're good to go.
We're good to go.
All right, good afternoon, everybody, and welcome to our COVID-19 special around the pandemic. Today we're gonna be talking with a group of directly impacted people about how this pandemic has impacted their lives and the lives of their communities. My name is Ruben Jones from the Close the Creek campaign, Just Leadership USA, along with my partner, Vidal Guzman from Close Rikers, Just Leadership. We have an illustrious group of panelists today who has collected hundreds of years of expertise on this issue of criminal justice. And we're thankful that you all join us today. It'll be an enlightening discussion. Feel free to chime in with your questions, and we'll do our best to answer them. And we'll also follow up with you after. So that's my brief introduction. Vidal, you want to introduce yourself?
How you doing, everyone? I'm humbled to be in this panel with advocates who are directly impacted, and making sure that we're educating directly impacted individuals on how to make sure that we're prepared organizing wise. But I am the outreach and engagement organizer for the Close Rikers Island campaign that is under Just Leadership. And I've been a part of the campaign for the last 4 years organizing. So I'm just, this is a moment where we start educating people and it has to be done. And yeah, that's really it.
Yeah, and I want to say that these jail closure campaigns are really tough. We did a thing this morning. I was trying to multitask. I don't know if I did a great job of the live Twitter chat, trying to get this set up. Still got my young one in the house. Hooked up my little background here in the home office. So hope y'all, loving our little Close the Creek representation. But, just to kind of give you a little bit of grounding in the Close the Creek campaign, we began advocating for the jail closure back in 2015 when the city wanted to build, purchase land to build a new jail. And of course, over the years of collaborating with numerous organizers and coalitions across the city, in 2018, we successfully closed that jail. So I want to say that the efforts that are being met right here with this group of people across the country, like there are results. As a result of some of the advocacy on the ground in Philly, over 900 people has been released since the quarantine. Now, with more than 4,000 people incarcerated, obviously that means we got a little bit ways to go, but I don't ever want people to feel like your work is in vain or you're not seeing the results. The reality is we are producing results every day that's moving our political structure, that's ending this machine of mass incarceration and changing the culture of the way people think. Like 5 years ago, people wouldn't even thought about making a push to get people out of jail. But now we're doing it, and I think we're not reaching the level of success that we would ultimately like to be, but we're getting there. And I just want to take a minute to give kudos to everyone on this call for the work that you're doing to push that rock up that hill. So we're gonna start with some introduction. First and foremost, I'm gonna start with my partner in crime at the close the pre-campaign, which is Mr. Bobby Harris. So you want to introduce yourself, Bobby?
Can you hear me?
Yes, sir.
All right, thank you. I'm honored to be amongst all of you on this panel for this discussion. I'm Bobby Harris, formerly incarcerated juvenile lifer that spent 29 years inside the state penitentiary. And since being released, I've been hired at Just Leadership to work on the campaign that we're pushing with Close the Creek successfully in shutting the jail down, but ultimately in shutting down prisons that's mass incarcerated to incarcerate the Black and brown people. In short, my story is, I'm always saying it, I'm boots on the ground fighting for individuals that looks just like me. Now we're faced with this COVID, and it's a transition that we have to make to address the people that still looks like you and I in this fight. And I'm honored to be amongst you all and the viewers.
Thank you, Bobby. We're gonna move over to Salim, another soldier in this fight on the ground in Philadelphia.
Thank you, Ruben, and thank you for inviting me on this important panel. My name is Robert Salim Holbrook. I'm the Director of Community Organizing for the Abolitionist Law Center. I'm a co-founder of the Human Rights Coalition. Formerly incarcerated, served 27 years as a juvenile offender, was released in 2018. And, I'm here to make sure that we could start taking advantage of this opportunity to start decarcerating, because really that's the only way that we can ensure that people on the inside are safe at this moment. So, I'm here to make sure that in this pandemic, someone is representing them, someone is out here fighting for them, someone is out here doing for them what they cannot do for themselves in this moment. So thank you for being here and giving me an opportunity to lift up their voices and, try and kick them gates in to see if we could get as many of them out as possible. And the ones that we can't get out, that we want to make sure that they are safe inside during this moment and they're getting appropriate and proper medical care, preventative care, and whatever else is necessary to ensure that they are safe.
Absolutely. And thank you for raising your voice on their behalf, my brother. Ms. Valerie Todd, it's always exciting to have you around, so we want you to introduce yourself, another comrade from Philadelphia.
Can you hear me? Hold on.
Yes, ma'am.
Sorry. I'm grateful. I'm so grateful. I love you, Ruben Jones, and I work beside you in PIC, and I was with you on the Close the Creek. I love people. I'm passionate about people. My mother was born in the House of Corrections. She was born there, so I just come from that, just feeling like I was always going to be in prison. I'm formerly incarcerated, spent 10 years of my life in prison, and I'm a person that I know I can't do everything, but I can do something, and I'm going to do something. I don't care about getting my hands dirty. I don't care about speaking up for people who can't speak up for themselves, and I just want to, I'll help anybody in any way that you guys want me. There's nothing that I find, hey, I clean toilets for 19 cents upstate. I don't find anything beneath me to do, and I'm grateful to be in this conversation. I got the passion, and what I'm doing out here is helping people have clothes, cosmetics when they get released. I have a woman who was released the other day who's sleeping at the terminal. Sleeping at the terminal right now because there's the place ain't letting you in because of the coronavirus, and because she was in RCF where someone died, they're not opening the doors at these recovery houses. So I know we're going to have time for that, but I did go to meet her with cosmetics and clothes. My heart, Ruben, I wanted to take her home with me. but I gotta have boundaries. We need these conversations so that we can get housing for these people coming home that have nowhere to go.
Absolutely. That's the bigger conversation, that making sure the institutions with multiple million-dollar budgets are allocating those resources to people in most need and not just relying on community resources to come out of pocket. So thank you for that. Keep it on the East Coast with our beloved Miss Kiana Johnson from Life After Release. You want to take a moment to introduce yourself, Kiana?
Absolutely, Ruben, and thank you so much for having me. It is an honor to be in this space and share this space with all of you today. As Ruben stated, my name is Kiana. I am the Executive Director of Life After Release. My organization is located in Prince George's County, Maryland, which is about maybe 5 or 10 miles outside of the Washington, D.C., outside of our nation's capital. And just to be here and to be able to have this conversation with other formerly incarcerated people. And let's be clear, that's what we are, right? We are not really returning citizens because, as you mentioned, we don't have the same luxuries and privileges as folks have that do not have the backgrounds that we come with. So we are still fighting for the basic human rights inside of the cage and both outside of the cage that we have to continuously put this voice, this collective voice towards. And it is an honor and a pleasure to be here with all of you today. So thank you for having me.
Thank you. If I could introduce your partner in crime, Miss Nicole Hanson from Out for Justice, also in Baltimore. We can't hear you, Nicole.
Can you hear me? Are you back up? Can you hear me now?
Yes, ma'am.
Thank you for having me. So I stand corrected. My name is Nicole Hanson-Mundell. Want to make sure, you know, I don't want my husband having no problems after. But thank you so much for having me. Yes, I am Nicole Hanson-Mundell. Here in Baltimore, Maryland, not too far from you all. I'm the executive director of Out for Justice, and Out for Justice is a grassroots-based organization that is led by formerly incarcerated women and men. I don't have as much time as many of you all here on the call, but 1 year behind those walls was definitely a life-changing experience for me. And I made a decision that day, that year, when I was released, that I would continue to fight for women who were in my shoes and women who did not have the voice at the time to advocate for themselves. And so the unique thing that Out for Justice does here in Baltimore, but even in the state of Maryland, is that we educate, engage, and empower ourselves around the legislative process. We believe that policy is not the only tool in our toolbox, but is a very important tool that supports our liberation and supports our successful reentry. So we pay close attention to the legislative process and lead on much of the policy reform that is happening here in Maryland. Thank you for having me.
Thank you for joining us. And I might add that Nicole and Kiana came up when you guys may have heard when the public defenders in Norristown got fired just for doing their job, representing their clients. And the ACLU and a bunch of other folks did a big protest, and both Nicole and Kiana came all the way up to support us in that effort. So I tip my hat to you. Thank you just for always being there for the people. Let's head out to the Midwest. Brother Hakeem. My main man, my guy.
What up, though?
What up, though?
D-Town in the house. What it do? Yeah, it's good to see all of y'all. I'm getting a chance to see some of y'all beautiful faces. Nice to meet some of y'all other ones. So thanks for inviting me on this this discussion, this panel discussion. My name is Hakeem Crampton. I work for JustLeadershipUSA as a statewide Working Future campaign coordinator here. Part of my role, specifically in the state of Michigan as the campaign coordinator for Working Future, is to work on building the capacity within our state for our criminal justice organizations and advocates to actually really form a coalition to really battle our state's barriers, current policies, laws, legislation, et cetera, that prevent people with criminal histories from having access to housing, access to affordable health care, access to education, access to employment, all those various things that, because people with criminal histories are now stigmatized and marginalized, those barriers ultimately present some of the most formidable forms of oppression that society can ever met out to its own citizens. And so the Working Future campaign is designed to actually fight that nefarious, almost evil, as you would call it, that has happened to us in this society. And I come to this work being justice impacted my entire life. I used to tell people that I was born on the pipeline to prison, single parent household, father, former pimp in the 60s in Detroit. Mother was out there hustling for my daddy the best way she could, finally left him, raised in the streets, crack cocaine era, hit us hard, hit young black males like myself hard, in and out of juvenile home all the early 80s, in and out of jail and juvenile till ultimately 91, spent 15 years in prison for a wrongful homicide conviction in Milwaukee. And that's where I started doing my advocacy work from prison, because first and foremost, I had to advocate for myself being wrongly arrested and convicted. And then I began working with schools and juvenile homes and nonprofit organizations, program development, grant evaluation from prison. And immediately when I got released after 15 years in 2006, I immediately hit the ground running in and out of our schools and our juvenile homes, at the table where people like me, people like us weren't welcome, but I made myself available, made myself present, and made my voice heard. And that built up a reputation for me in the state of Michigan doing this kind of work and partnering and collaborating, just having a wonderful ride and experience and working in advocacy and using my voice to impact this arena. So just glad to be here. Thanks for having me.
Thank you so much, man. Appreciate you. Did we lose Sean? Sean, you still there? I think we might have lost Sean from St. Louis, but let's go out west to James Nelson, Dignity and Power Now.
Hey, how you doing, Ruben? Hey, everybody, how y'all doing? Hey, just like so many others have said, this is a blessing and a wonderful opportunity to be amongst you guys in this conversation. Hakeem sounded like he was sharing my personal story, while he was talking, because I'm too from the neighborhood. I grew up here in LA in the Watts area, and got into the lifestyle of gangbanging, selling drugs, and became known to the police, and to the point to where they wanted me off the streets, by any means necessary. And they framed me for a murder at the age of 19, where I was sent away and did 29 years in prison, and like I say, just like Hakeem said, I could have stayed bitter while I was in there, but I had to make a choice to where I needed to work on myself, because one day when I was to come home, I want to be a better person. So I hooked up with a bunch of self-help groups, and first of all, worked on myself, and then became a mentor in a juvenile youth program. Well, not the juvenile, but the youth program that's inside of the prisons called Life Cycle. And, took that wholeheartedly, and I became to the point where I felt like that was my calling, to be a servant, and that's when my life really had a pivotal point, and upon my release in 2014, right, I was introduced to Patrice Colliers of DPN and Black Lives Matters, and I went and met with her and started volunteering with DPN and became a part of that work. And again, though, over 5.5 years ago, sitting in the cell, not ever knowing if I'm ever gonna come home. But then get to come home and to get to hook up with people locally, get to hook up with people on a national level, that had the same interests, the same drive, and the same unselfishness, because after you be directly impacted and then you come home, it's easy to become selfish, and because so much has been taken from us. It takes a special kind of person to be unselfish and think about the brothers and sisters that we left inside. And that's why I'm so glad to be a part of DPN, where I'm senior campaign lead, where I led on the jail fight here that we just recently had in LA, and again, it's a bunch of folks from our communities, directly impacted folks, that's at the table now, making changes, and that's what it's about. People build power. And again, I won't say too much now, but thank you for inviting me to this platform.
No, I appreciate you, man, and all the work that you do. When I, was out in LA, James was my guy. You know what I mean? Like, that's who I was taking care of, and introduced me to some folks, and like we build the relationships, man. Like each one of us on this call have relationships in other cities and states. I just want to make this clear. If we accumulated that power of all these relationships that we have individually and bring them to the table collectively, we got a force. We got a force to be reckoned with. And I just want to plant that seed, and we'll come back to it. So also on the West Coast, representing LA, the Anti-Recidivism Coalition's Executive Director, Mr. Sam Lewis.
Hey, good morning, everyone. Afternoon for you all. Good morning in LA on the West Coast. Good afternoon in the Midwest and the East Coast. I'm honored to be here amongst my peers. I'm also formerly incarcerated. I spent 24 years in the Department of Corrections in California. Went in as a teenager, came out as a middle-aged man. Been home now 8 years. I'm now the lead or the executive director of the Anti-Recidivism Coalition. We've passed 17 pieces of legislation that have incrementally changed our criminal justice system, focused on juveniles and life sentences, including eliminate life without the possibility of parole for juveniles. So that's part of what we do, but we also have a support network made up of over 1,500 formerly incarcerated men, women, and juveniles. And what we basically do is we empower through resources, whether those resources be education, trade, or the power of advocacy. So during a legislative cycle, for instance, we might journey up to the Capitol 100 deep with ARC t-shirts, pins, and shirts and ties on, and basically advocate for the laws that we know need to be changed. Many of our ideas for advocacy and policy change come from inside. We're inside providing rehabilitative programs now in 10 prisons, 2 women's prisons, 8 men's prisons. We're also in the juvenile halls and camp using both our life experience, but mentor training that we use to help youth that are coming home and make sure that they don't matriculate into the adult system. So we're a statewide organization. 70% of our staff are formerly incarcerated or system impacted. We believe that, and this is something that me and Ruben learned in the alumni, the 2017 cohort of Just Leadership. Those that are closer to the problem are closer to the solution. And Glenn Morton said that, but usually furthest from the resources. But that's beginning to shift as more and more foundations are hiring formerly incarcerated people to be program officers. And I was talking to one of those program officers yesterday, Ali, and I want to say this to everybody that's formerly incarcerated. For people like Ali, we do the work, but the other part of the work that we must do is document, so that we can give those numbers to people like Ali, so we can demonstrate, one, this fight that's being led by us needs support, but we need to support those that are supporting us by demonstrating that what we're doing is impactful. The stories are important, but the numbers are important also. Thank you again for having me, Ruben, and it's truly an honor to be here. I see another one of our alumni, Sean, just popped back up. Dr. Gardner, that is. Good to see you, brother.
Yeah. Before we get to Sean, I just want you to unpack one thing really quick, because I don't know if everybody knows who Ali is, but he's a formerly incarcerated brother who works for the Zuckerberg Foundation, and they put money out there. Do you want to just take a minute and tell them who Ali is and what his impact has been with you?
So I met Ali in San Quentin. While I was out, he was still inside. And Ali, like like, all I can say is the brother's dynamic. And when he came home, he had already planned to be in this fight. And so he started working with the Zuckerberg Foundation, and literally he supports us 100%. The leadership of formerly incarcerated organizations, or organizations that are led by formerly incarcerated that are looking to change this system. The brother's deep, super smart. I'm always impressed when I'm around him. Like literally, I'm older than Ali, but I always feel like I'm a student when I'm around him. I just want to listen to him. And he's one of those guys, like, give him the power to be able to support us by giving him the numbers and the stories. Stories are powerful, without a doubt. Right. But the numbers and the impact are the things that Ali and people like Ali that are formerly incarcerated, that are in the world of philanthropy need in order to continue to crack open that mysterious, so-called mysterious world of philanthropy. And if we continue to give them the tools, I'm certain that we'll be able to not just end mass incarceration, but to some extent be able to create a pathway for everyone that's ever been touched by the prison system to live what I call their best life.
Absolutely. So last but certainly not least, all the way from the Lou, Dr. Sean Gardner. You want to take a minute to introduce yourself?
Yeah, just want to, my apologies getting my screen set up, man. I had a video problems using my cell phone, learning how to get that right. I'm Dr. Gardner from Louisville, Kentucky, CEO and founder of 2NOT1 Father to Family. I just want to say thank you for allowing me to be on this panel. And yes, I do see some folks that went through JustLeadershipUSA, leading with conviction with on the panel. Hey, Sam, it's been a while. But no, with 2NOT1, our mission is to promote the safety and well-being of children by implementing strategies to keep fathers involved and families together. So what that looks like is just working with families, but being very intentional about including our efforts to work with fathers. And I have to admit, going through JustLeadershipUSA, being formerly incarcerated myself, then on top of that, getting a partner in 2015, I don't know if we were very intentional about recognizing the folks who had those experiences. And then when we started capturing the data, like Sam was alluding to, just picking up on all the information and assessing what we were doing, we realized that 98% of our participants were just as involved with formerly incarcerated. And so what that means, we have families who were dealing with struggles. And we already knew that to a degree. One of the primary struggles we faced with families were parents who wanted to go into the school system and volunteer, and they weren't able to do that because of their record. So we were focusing on helping with that situation and then other situations that came out as a result of understanding just who our demographic was. So that's a little bit about what I do. Thank you for having me on the panel, Ruben, and glad to be on here with the rest of you.
But Dal, before we go into the question part, do you have anything to ask or offer?
I don't know if everyone went through. I hear Ms. Johnson kind of go through and introduce herself. I don't know if everyone introduced herself. Everyone did? Okay, cool.
Yep, we got everybody. Yep.
So let's get right to it. You know what I'm saying? The Close Rikers Island campaign is a 4-year campaign led by directly impacted people. When I joined the campaign, we was at 10,000 people who was incarcerated on Rikers. And in 2016, the Department of Correction tried to open another facility on Rikers, but the stop was processed in 2016 when we did a march of 1,000 deep to Rikers Island. And the person in the Department of Correction said in one of their hearings that it was because of the Close Rikers Island campaign that process was stopped. So in the last 4 years, our population declined from 10,000 to 4,000. One, I always say this, is because of the leadership of directly impacted people. Now we're in every space that are including about the criminal justice system. But the most important thing that made Close Rikers Island unique is the importance of coalition building. So our coalition just don't include directly impacted people, but it include lawyers, it includes environmental justice advocates because of our renewable Rikers, and also included reentry faith leaders, and I could keep going on. But what happened now and what we're able to kind of push out since last year, the city council made it legally binded that after 2026, that Rikers Island cannot be used for any jail closure at all. So that's a big accomplishment for all of us. And we also cut the jail population by 75%. And one of the things we have just seen the mayor recently kind of do, and it was one of our demands, was by ending year sentence. So he released approximately 300 people who are nonviolent, to be released. But another thing about it is that we're still fighting to make sure that they are released and they don't go back to jail, right? The reason why we say that is because there's a conversation that's going on about when this is all over to get back people back into jail to finish their time, and that's horrible. So we're just making sure that does not happen. And then recently, you know, with our partners who work on the state side, pushing Governor Cuomo, he released 1,100 people who are violated for technical violation. And out of 1,100 people, we're still trying to figure out who exactly and how that process is happening, right? The other process that we've really been serious about was our Freedom Now campaign, humanizing family members and people who are inside, because we understand about politicians, they always make decisions without exactly knowing who are the faces or the family that they're making the decision about. So we have a campaign called Freedom Now that has people's pictures who are incarcerated and family members' quotes. And it's been really successful to kind of push city council. The Department of Correction, they have a board of correction who is independent from the Department of Correction, actually put out a letter to DAs, judges about releasing 2,000 people who has underlayer health problems or over 50 years old. And because of that, we have seen approximately, we only have seen 1,100 people being released from that. So we are still pushing on that process to happen. And the other part that we've been really falling on is our coalition building as our legal aid society partners. As if you have been paying attention, is that they've been really pushing to release people. And I think for us, where we at right now is the importance of pushing the mayor to end broken window policing, because I don't understand, and we don't understand we are the epicenter of the COVID-19, and there are police who are still incarcerating Black and brown kids in our neighborhood for low-level crimes. So we come to a certain point of how we exactly coalition built, and if we are stepping in spaces when it's being talked about directly impacted people or policies that make us stop or makes the policy stop, we get individuals who are in that same field, the public health field, the reentry field, the faith leader field, to make sure they align and make sure they are fighting with us. But as we're continuing to kind of free people, some of the conversation that keeps stopping us is the nonviolent, violent conversation. But we have seen the drop of the jail population to 4,000, and we're going to keep pushing by making sure that we end the gang database and make sure that we're not incarcerating people, or the city's not incarcerating people who are sex workers, decriminalizing sex workers. And we are making sure that our Build Community platform, last year we won a huge victory when the policy was passed to get the city to 12 to 4 jails. Also big budget investments was passed with that, approximately 391 million. And some of those 391 million aligns with our Build Community platform that was created by directly impacted people in all 5 communities that have been impacted. And just to see that Build Community platform being echoed by city council, nonprofits, directly impacted people, is knowing that we are in the right step, in the right moment, but we are still pushing it all different a line and agenda to make sure that people are not dying, right? Inside our jail system, we have lost 2 people in Rikers Island, and we also know the correctional officers are the highest correctional staff in Rikers to have COVID-19. So approximately a huge number of the people in the population has COVID-19. And what we learned, there's 300, the number keep increasing. There's 367 people who are detained on Rikers Island with COVID-19 because of dormitory areas. We know that you can't social distancing in a dormitory area that holds 50 people. And yeah, I can kind of stop there. Those are some of the things that we're really pushing on, but we've been really falling on the coalition building and knowing that if we're not able to push as advocates, let's make sure that public health are creating the pressure that needs to be done. If it's individuals who are reentry who are doing reentry and they're part of the coalition? How do we make sure that we align them to head on and create a letter to push on to the mayor or to make sure they make demands that happen? So for us, the Close Rikers Island campaign, we're a directly impacted coalition, but our allies been really helping us push out and push on the mayor and the governor.
All right, cool. So we heard from everybody, and again, I tip my hat to everybody on the call. We can ready to drill down right now to some very specifics. Sam, you alluded to something that those close to the problem are close to solution, but furthers away from resource and power, right? Glenn Martin, genius. What I want to drill down is a couple things, because I don't want to play no games with this. COVID-19 is disproportionately impacting Black people, Black and brown people, marginalized communities, and incarcerated folks. We know all the numbers about social distancing. We know the lack of resource available inside these jails. You guys are experts on that. I want to talk about how the lack of response, or maybe there is a response in your city, but the lack of response from city officials and leadership is one, city government. The lack of concern for state prisoners by governors, by DOC deputies and commissioners, right? I want to talk about how we can't even mobilize the public, let's be honest, to give a damn. Kanye West said in relation to the Katrina flood that George Bush don't care about Black people. But I'm here to tell you that our mayor, Mayor Jim Kenney, our governor, Governor Wolf, don't give a damn about Black people, poor people, or incarcerated people. And their lack of decarceration has demonstrated that. Right now, Philadelphia has decarcerated less than 20% of its population. And if you do the numbers, it's actually about 14 to 15% because the bail funds have bailed out more than 200 of the 900 people that's been released. So we can't even give the city all the credit that they are patting themselves on the back for. The governor, out of almost 50,000 people in the state prison, is talking about releasing 1,800. And of course, they're going to go for the low-hanging fruit for the 1,800. So I want to drill down specifically, how has this COVID-19 pandemic impacted the people in your community, both Black and brown, business owners, and those who are incarcerated? What's the response? What's the lack of response? Anybody?
– This is Kiana. I'll go ahead and start first. So in Prince George's County, Maryland, and Nicole can relate to Maryland as a whole in the entire state, but I know in our particular county, when it comes to the most marginalized folks, just to go and get testing is an issue, right? And to be able to get health care as if it wasn't an issue before COVID-19, it is just now expanded upon the fact that people who are formerly incarcerated and people who are, marginalized communities don't have access. Here in Prince George's County, you have to have a doctor's note, right? So a person coming out of a cage is not going to have a primary care physician. They're not going to have access to go and get these doctor's notes. So right then and there, you're putting a barrier to the access that you're saying you're giving to everyone. So I think we got to be very mindful to pay attention to the different barriers that are being placed that are going to stop directly impacted folks coming out of cages, folks with limited access to undocumented folks. It's going to stop us from being able to go and get the care and help that we need. And that's the reason why Black and brown folks are dying in the streets from COVID, is because we're being turned away from hospitals. We can't access the health care that we need. So I just wanted to put that piece in there. I'm sure everybody else can talk about another piece of why their particular jurisdiction is failing us as Black and brown and as formerly incarcerated folks, why it's failing us. So that's one of the reasons I wanted to point out.
Thank you for naming that, because we can't play games with this. This is real life. I see Celine, Nicole, and I think Bobby had his hand up too.
Who's next? Oh, Bobby.
Celine, Nicole, Bobby.
All right. Look, I think that this is something that we really need to lift up, and that is that Black and brown people have always been vulnerable populations in the United States at whatever epidemic or crisis hit this country, whether it was a natural disaster, Hurricane Katrina, we see Puerto Rico, whether it's recessions or depression, whether it's a global pandemic, whether, you know, it's poverty. At whatever level we encounter the state, we encounter the system, you know, Black and brown communities are always vulnerable. And I think that's something that we always have to frame out, because it's not like we were ever on equal footing in this country with any other ethnic groups or populations. So that's very important. In terms of the state's response is that of a failed state. You know, that we live in a failed state. We live in a failed country for all its wealth. The reality is the United States doesn't have the infrastructure to meet the basic needs of its entire population, not much less its vulnerable population, right? And so for us, this is why we are disproportionately impacted. Now, when we talk about mass incarceration and imprisonment, you know, these communities, you know, our people on the inside, they're bearing they potentially could bear the brunt of this, because if there is a outbreak in prisons, let's be straight, you know, they're not going to be first in line for ventilators. You know, the Department of Corrections has close to 50,000 prisoners in it, but they only have 4 ventilators in one prison. So let's be straight, you know, if there's an outbreak, they're not going to have the capabilities to respond to that. And it will basically create a mad rush between surrounding communities and prisoners for access to those resources. So for us, decarceration is the way that you get ahead of this. You know, everyone is talking about flattening the curve. You know, our objective is to get ahead of the curve. In Pennsylvania, we have 27 confirmed cases in one prison, SCI Phoenix. However, they're not doing any mass testing in Pennsylvania state prisons. And we know from this that many people could actually have the coronavirus and be asymptomatic and be cool and have no problems, but they could be carriers and pass it off to others. So, you know, there's no doubt that there's a lot of people in the Department of Corrections who are infected right now and carrying this right now. We're hearing reports unconfirmed out of Fayette that there's potentially dozens of people up there positive. Now that's unconfirmed, but you know, this is the reality. So for us, our position is we're putting pressure on, and the reason why I'm talking about the state, because that's pretty much the lane that we're moving in right now. Ruben could talk more about the county, but for us, you know, when we talk about releasing state prisoners, we always run into that violent offender, non-violent offender binary that really is disgusting and really impedes a lot of our work, right? Because when we talk about the vulnerable populations, the people who are most vulnerable to this are seniors in the Department of Corrections and prisons, and people with compromised autoimmune condition. When we talk about seniors as a group, this group constitutes the least threat to public safety. If you want to talk about public safety, people 50 and over, you know, have one of the lowest recidivism rates in the country. In Pennsylvania, that recidivism rate is less than, you know, 12%. However, if you go up to the vulnerable groups as described, as defined by the CDC, which is 65 and older, right? The Department of Corrections, first of all, their recidivism rate is less than 3%. So they have the lowest recidivism rate of any population. But also in Pennsylvania, Department of Corrections right now, and this is one of the areas where being in a law firm gives us some leverage that we could get this information from the DOC, whether through threat of a lawsuit or any other means. We was able to get that data from the DOC last week about their population over 65 and over, and we broke that down. And in Pennsylvania right now, there's over 2,000 prisoners who are over the age of 65 who are over their minimum sentence. So from our position, I don't care what they're in there for, they should not be in prison now. That population right there, they have served their minimum sentence. They should be expedited for parole. They should be given presumptive parole. And that is, if they completed all their programs, if they jumped through all the hoops that they had to do, get them out. If they're there for parole violations, get them out. If they're there for parole hits, get them out. Because let's be straight, a 65-year-old person is not going to present a threat to anyone out here on my block, right? And I'm sure everyone on this call and people who are listening could relate to that. However, there are also over 300 people who are age 65 and older who are within 6 months to their minimum. So they should be expedited for release. There's another 1,500 who are within 1 year to their minimum. They should be covered by Governor Wolf's reprieve power so that they could come home, right? So this is how we're angling this. We're attacking them with the data that they often use for us with risk assessments and all that other nonsense. So what we're doing is we're taking the data that they have and we're turning around and basically saying, we know what you can do. You're telling us that you can't do certain things because your hands are tied. However, I did time. So you can't tell me that. I know how parole operates, right? I know that you could expedite hearings. I know that you could hold hearings for people whose parole was revoked. You know, so that's the angle that we're going about, specifically trying to get the seniors out right now who are as defined by the CDC, but also for people who are suffering from medical conditions, because Pennsylvania has medical furlough that the Department of Corrections and Governor could use. So we would like them furloughed home. So these are some of the lanes that we're moving in down here and putting pressure on the governor and the Department of Corrections. We're putting, that pressure is coming from multiple areas. It's coming through public statements. We partner with some other advocacy groups to do op-eds. However, we sued Allegheny County Jail because they weren't letting people out. Fortunately, now they've released over close to 1,000 people in a month as a result of the pressure in the lawsuit that we just dropped. And we're ready to sue. Well, I mean, we're exploring options to sue the state. You know, those are a little, you know, more complicated, but we're reviewing the claims that we could raise. And so that's another option that we have on the table. But for us, we're going hard in this moment because if there's one thing that we could see is the state is in crisis, and whenever we're in crisis, the state, the right, whoever uses that as an opportunity to go hard with their plans, right? You know, we seen how when Katrina destroyed New Orleans, you know, the right basically said, you know, it's good. It pretty much cleaned that city of poor people, and they was, you know, able to implement plans that they wanted to implement. From our standpoint right now, the state is in crisis mode, and we should take advantage of this and push as hard as we can for decarceration and also other programs that will benefit our communities. You know, we're in a contest right here. That's how we have to look at this, and we have to take this seriously and move hard in this moment.
Salim, thank you for each of those points you raised. I want you to make a note of a couple of things I want to come back to later. And that's that political will you talk about. We know what they could do, right? But it's what they choose to do and what they choose not to do based on the political will. Also, you talk about the medical furlough and the reprieve. I want to come back to those two things. And then some of those numbers that you mentioned about folks 6 months short and folks with tech violations. So let's come back to those three things because I want to make a point about that. But I want to get Nicole and Bobby in. Nicole?
Hey, man, Brother Robert, like, we are so in sync with the demands that you all are making there. What is happening here, and I want to just make sure we follow up and connect with you to get additional advice on how we could be kind of in line statewide with some of the efforts that you all are doing, because you all are kind of ahead of us in terms of lawsuits in Maryland. You know, we on many of these calls that we're on, I find myself, you know, being the only one saying we need a lawsuit, we need a lawsuit. And in a time like this, you know, I just wish I had a law degree that I would be able to put on the line and file suit. But, you know, sometimes you have attorneys in the state that want to play nice, and, you know, they don't want to make certain people upset because they have other ambitions. But our governor here in Maryland, Governor Hogan, who is essentially, I think, he's a part of the a group of governors. I think he's one of the presidents or something of governors across the country. And he was very late at issuing his executive order. he only issued the order some few days ago because of the pressure that folks continue to put on him about releasing our loved ones. He did things like, you know, he told his parole board to make sure that folks was getting like the maximum, no restriction on their diminution credits. He talked about releasing individuals over the age of 60. He talked about releasing individuals who have violated their probations. But our problem is he talks about not including individuals with violent offenses, right? So how do you talk about releasing individuals over the age of 60 when we know many of them have served 10, 20, 30 years behind those walls that likely have violent offenses? So in one breath, you're saying release folks at over the age of 60, but in another breath, you're actually excluding them from your order. And we put out our response to him clearly indicating that. We had our state's attorney here in Baltimore made, I think, about 3 requests asking him to, wave his magic pen to begin to reduce the prison population. And she is doing what she can do in the capacity that she can. She looked at about individuals with who have violated probation. She looked at individuals who for early release. And so she did what she could do in terms of supporting reducing the prison population, but it's not enough. And so what we found that we had to do locally through the national mama bailout, because conveniently a mama bailout happened, is happening now in parallel to COVID. And so Kiana is bailing individuals out in Prince George's County. And what I'm finding here in Baltimore is that Black women are not receiving bails. We have judges that the minute that the governor shut down the state, and at the very time that the governor was shutting down the state, was still issuing no bails for very minor offenses. So what we had to do was just look at what these different levels of government could do that could circumvent a judge's order for no bail. And so we had then begin to collect the stories of all the women, specifically locally, I'll talk about really quickly, all of the stories, all of their offenses, and begin to advocate to the state's attorney, hey, based on your guidelines, you talk about that you are interested in releasing people with these certain offenses. We encouraged her to add a second-degree assault, because in the state, in Maryland, second-degree assault is the number 2 offense for all Marylanders. And so we're getting our folks information out to say, hey, we need you releasing these individuals too. But then we are having to contact these individuals' attorneys, whether they're panel attorneys, they're public defenders, or private attorneys, and saying, look, we've gotten support from our state's attorney that she will not object to a motion for release, or she will not object to a motion for home detention. We now need you to do your job to enter a mandatory release. And so a motion for mandatory release. And so what we've been advocating for is that the state's attorney's office, the office of public defender, and pretrial are all on the same page in terms of getting our folks out. Because what we're seeing is they are approving people for home detention more than they're even giving individuals bail. And the level in which people are getting out is very slow. They're slow walking out people, right? So if the governor giving the order 4 or 5 days ago, you're not seeing this mass number of people getting out because, one, the folks who facilitate this process are our case managers. And case managers are afraid to go inside the institutions because, one, they are not protected. They're not given protective gear. And so what I'm finding is that they are working from home. And so whenever I get a call from a case manager, or whenever I get a contact for a case manager, I'm pretty much bugging them to kind of, speed up this process. The other thing that is very disheartening is that while healthcare workers, naturally, they need a protective equipment. And we know that there are some loved ones of ours who may not come home that's in the state institutions. They just may not come home. And so what we're asking is, what we're demanding is that the same way you were able to wave your magic wand and request that people come out and tell your different agencies to support each other in ushering our people out, you can wave that magic wand and get our people some of the best medical attention that the state provides. Because we live in a state like Maryland that arguably has some of the best medical institutions in the world. We're here right next to a place like Hopkins and University of Maryland. And so our women and men are sitting in prison, and the minute they show signs or complain of signs, they're ushered into a dark, grimy place called the infirmary. And then our folks are not they don't have updated medical equipment, right? And so what we're demanding in our letter to Hogan is that get our people in updated medical equipment. Get our people in medical professionals who are equipped to deal with a pandemic, because the current medical professionals that are in Maryland state prisons are subpar. And I don't mean to say anything bad, because they got a job, but their job is through a company called Horizon. And I've really been damn near begging some of the attorneys that I know to sue this medical aid company, because they are running medical like a staffing agency with no oversight, okay? And so that company needs to be sued, because our people are reporting they don't see a doctor but once a month or once every 2 months. So if somebody is complaining of signs and symptoms, how is the state ensuring that you have medical professionals that are in there, or get our people out of those institutions and get them the medical attention they need? We have hospitals in surrounding counties who are denying to take people coming from jail to the hospital. They won't even take them. And so I agree with this, we talked on the phone before, and it seems like the remedy is a lawsuit. They only respond when you are touching their pockets. There's another part of the order that we are very concerned about here in Baltimore is they're just leaving our folks in there to die. It's horrible of the stories and the loved ones who come in, who call us talking about they can't get in touch with anybody at the Department of Corrections. Our advocacy looks very different. Normally, we're able to bang down the doors of the Department of Corrections. We do a lot of policy reform in Annapolis and stuff like that. So we're able to push our elected officials. But outside of State's Attorney Marilyn Mosby, who essentially is on the opposite side of us, right? Like technically she's a state's attorney. We're finding that she's on our side in many cases of reducing the prison population. Outside of a few state legislators like Senator Jill Carter, Senator Mary Washington, and Delegate Deborah Davis, the rest of our lawmakers here in Maryland are mute. They're acting like they're afraid to stand up to Governor Hogan. And this is a governor who essentially will not be in office during the next election. And so, we're going through it down here, because in the local detention centers, people who are eligible to be released are not getting released at the rates that they should. You have a situation where people are going to be released to home detention. However, they may or may not can afford it. We have a governor's order that says that you need a home plan in order to be released. And quite frankly, that is not fair, because many of our folks behind those walls, loved ones have passed away, or because of certain relationships, they don't have anybody that they can say they can come home to. But we do have different institutions. We have Alpha Justice, who is working on a very comprehensive housing plan where we are identifying landlords, drug treatment facilities.
Oh, I love your passion, girl. You delivering on that. But we got a bunch of people on stack. Can I come back to you so we can kind of, because I think we all agree that the situation is fucked up across the board, across the country. Like, so we feel you on that, but I want to get a little bit of perspective for some other folks around the country too. Is that cool?
Of course, of course.
All right. So I think we had next was Bobby, and then we got Hakeem. I'm sorry, Bobby, and then Sam, James, Hakeem, and then Sean. So Bobby.
Thank you, Nicole. First and foremost, I like that energy.
Yeah.
I want to say, Rube, you asked a question regarding, about the elected officials, or what the policy looks like regarding individuals, in our city. And I'm going to name particularly Philadelphia. We have a lot of charlatans. I always stress that. I mean, they're pretending. And whenever we're looking at that, they operate from a system of, evidence-based materials. When we're looking at that, we can look at the Department of Correction in the state of Pennsylvania. They're declaring that there's over 12,000 out of nearly 50,000 individuals in the state penitentiary that's vulnerable, towards this, COVID-19, virus. So when we're looking at that, that's evidence-based materials, but yet the politicians, they're not looking at that number and saying, how can we address that issue and bring them individuals out? Because if they're not nonviolent offenders, it's of no substance to them. So they don't operate from the perspective that we do. When I say we, every last one of us, we're formerly incarcerated people. We come from a whole nother system, and we was all labeled as problematic inside of the penitentiary, not because we was violent, but because we chose to advocate for civil rights, within the penitentiary, as well as for it on the outside. And we come out here doing just that. That ability gives us the power that we need to challenge that. We can't expect a bunch of other people outside of us, the directly impacted community, to answer our prayers. We can answer it ourselves. We got the resource. I'm just listening to when the sister Nicole was just explaining that they need that lawsuit opportunity. One thing we know Salim and them do, they provide that service. So the purpose of this here is for us to pull our resources, to qualify ourselves, and to hammer home like a sledgehammer towards them individuals to get our individuals released. And I mean, so looking at that, I'm really looking at this, and I like what they did, because I actually sent Nicole an email, and I sent the doctor, I forgot the name. I wanted the emails because I wanted to link with them with some of the things that we're doing. We have a large population that's dying. They don't talk about the individuals in the state penitentiary. I come from the state penitentiary. I live and I breathe for them individuals in there. I love and breathe for the individuals that's in the county jail. But we have a major neglect in the state of Pennsylvania when it comes to state prisoners. And I mean, so we're looking at like that 12,000 out of it. Celine mentioned about, there's over 2,000 that's over the age of 60. Yet there's over 10,000 over the age of 50. But they can't be reviewed or considered. So other people in this field that's talking about, let's end mass incarceration, that's going on inside of the state of Pennsylvania, particularly for our state, it cannot be limited to the county. We have to attack hard and harder for the individuals in the state penitentiary to bring about that relief. And I mean, and it's about, like I said, pulling our resources. So how do we do it? We hammer home. We grab whatever resource that they may have over there, we grab that. Whatever resource we may have here, and I'm gonna go back to with Cabby and them, they have that law opportunity, available to file lawsuits and challenge. We at Just Leadership, we got that boots on the ground like others, this is the moment for us to really address, but it has to be focused for me and for numerous other individuals that's on this call, that state. That's 12,000 people that's vulnerable. So when the governor say that I'm going to release 18,000, he's a fake. He's a fraud.
No, 1,800. He said 1,800.
Yeah, I stand corrected.
Well, at least your governor gave a number. Our governor didn't even give a number.
Well, that 1,800, that don't answer the call. You are contributors to murder. And if we don't address it in that manner, every politician or every whatever entity exists that does not address the vulnerable population in this society, whether in prison or out of prison, you are a contributor to first-degree murder. And we should hammer home just like this. We're talking about a state of emergency that's going on. And if you neglect to address the individuals that could fall or succumb to this virus and lose their life, you are a contributor of first-degree murder according to your own damn law. That's what I wanted to say.
So Celine put in the chat box, out of that 1,800, they've actually only released 86 people.
Yeah.
So that's very minimal when you talk about almost 50,000 people. And I want to say one other thing about when you say they charlatans. Like, I agree 100%. And I think part of our job is we got to start calling these people out, man. When you go to court and let's say if you ever had a rappy, they tell you conspiracy if you did anything in furtherance, or if you neglected to stop that act, right? So we got people who know that this virus is killing people from close exposure, from touching the surface, from a cough or a sneeze. And you're willing to allow people to sit in there and be subjected to this illness that you know could kill them. That makes you also an accessory or conspiracy to commit that act of murder. And they're only doing it because this is a population that they clearly do not care about. If I could take 2 seconds, 2 minutes, that our mayor, and I'm always going to call you out because you're a hypocrite, Mayor Kenny. Our mayor got on national TV talking about the city was renting out these 3 hotels to put people up in during this pandemic. Well, we were trying to get 14 people out of jail last week. They were all true coming from the county jail, but they had the nerve to tell us that those hotel rooms, that's not what they were designed for in terms of the city spending money on prisoners coming home. And it was such an insult. It was so disgusting. It turned my stomach. So you're saying some of these people who had nowhere to go, who was scheduled to be released, but didn't have a home to go to or home plan, whatever, they turned a deaf ear. They washed their hands like Pontius Pilate and said, I don't care. So that, to me, so I agree with you, Nicole, about the lawsuit and Celine. Those are things we have to look at. The governor, who 86 people out of your 1,800 was bare minimum, right? And we talking about upwards of 12,000 people who will be eligible for these, and you release 86 people. That's a criminal act. And that's one of the leverage points that we got to have and raise our voice against these governors, these state reps, these state senators, city council, mayors, everybody on that chain has to be held accountable. And we got the forces and the ability and experience and the skill to do that. We just got to strategize around that collective power we have to make it happen. So thank you for, yeah.
I just add this one thing. Before we end this, could we all share whatever resources that we do have and is available, whether they in Pennsylvania, Detroit, California? We should be able to share those resources with other directly impacted organizations that's working to answer the call for our people. And then we can build our own base while we know them other folks are playing. But let's share that because there's numerous ones we would like to share.
So during our solution section, once we get through these last comments, we're going to come back to the solution, what we can do. And people that's what we exactly can do is people share the resource they have or have access to. We're going to bring them to the table collectively. And we're going to make that impact. Absolutely. So I think we had Sam next, and then Hakeem, and then Sean. And I think that's it. Who yet? So Sam.
So again.
James. I'm sorry. Sam, James, Hakeem, and Sean.
Again, good afternoon. So we work on both the state and local level. So I'll give you a snapshot of both. So first, the state, as of yesterday, 155 people had tested positive in the Department of Corrections. There's been one death. A total of 770 people have been tested. A total of 105 employees have tested positive. 770 tests out of 120-something thousand people currently incarcerated is not enough tests to find out how many people actually have it. So that's just a snapshot. Now, and when this began, ARC, in conjunction with some other community-based organizations, the ACLU, and others, we pushed a letter to the governor and were instrumental in convincing or maybe tilting him in the direction of releasing 3,500 people that have all been released now without a hiccup. And the key to it not being a hiccup was community-based organizations across the state connected and provided transportation, made sure that there was housing. If you were going home to your family, you were literally picked up from the institution, driven to your family's house. And it wasn't one organization doing this. This was organizations from the top of the state to the bottom of the state, providing transportation. We've also been working in conjunction with other organizations to raise a pool of money through the philanthropic branch to be able to provide stipends for people that have been released, because right now you can't get your ID, you can't get your social security card, you can't get money basically. And so the idea, the pot of money is there, and the idea is to be able to provide cash cards as long as the individual is programming with a community-based organization. And programming meaning you're involved with something positive and you're not involved with any negative things. And the reason why is because as this gets worse and we continue to advocate to have people released out, people are desperate. I'm certain all of you have seen the food lines, people losing jobs. It will be easy for those in power to say, well, uptick in crime is because of the people that we released. An uptick in crime could possibly happen without anyone being released, because right now people don't have jobs, people don't have food, people are desperate. And if I was in that position and my babies were hungry, I'm not certain what I would do if I couldn't get it. On the news, you hear about people standing in line for hours who have children to feed, and when they get to the food bank, there's no food. So taking in consideration all of those different dynamics, what we've been doing with a collaboration of like Dignity and Power Now and many other organizations throughout the state is trying to make sure that as people are released, they have resources, that they're connected, that they're not alone, and that we're guiding them so that they know that there's going to be a pathway after COVID-19. We're also working with different individual donors. So for instance, yesterday we were able to donate 14,000 bars of soap to one of the institutions, and that's had a chain reaction where there are others that want to donate on large scales to different institutions, and they want to know in California what they can do. And so what we've been doing is like literally staying plugged into what's happening inside the institutions. So for instance, the Department of Corrections is actually producing hand sanitizer to pass out to everybody. And I had to see it for myself because I read about it and I said, I need to see for myself. So I literally went in yesterday, got a bottle of the hand sanitizer, took it out. It's pretty good too, and I have used it, but it surprised me that they shifted and were able to do this in what's called the prison, PIA, which is a prison industrial, PIA is, I can't remember the name, the acronym, the name for the acronym, James, PIA, Prison Industrial.
Prison Industrial Authorities.
Yeah, prison industry authority, where they make like clothes and all those things. So they've shifted the soap plants to making hand sanitizer to be issued just for the Department of Corrections. They shifted the clothing textile mills in 3 different institutions to making nothing but masks. And so I was able to actually see the mask yesterday. I went to take some, and they said, come back in a couple of days, they'll give me the mask. Yeah. And I'm trying to verify in every institution is everybody receiving these institutions. So people
there's a question.
Pardon?
There's a question. Does the sanitizer have alcohol in it? 75% alcohol is the kind of the standard to kill coronavirus?
Yes, it does. It's got ethyl alcohol. This is 60% though.
60%?
Yeah.
Yeah, so that might not kill the coronavirus, but
Wait a minute, because I got another one here. This is store-bought.
Is he saying that this is going inside the institution?
yes.
This is produced inside the institution. It's actually produced inside the institution.
And what institution, y'all, where are you?
California. So the other things that they're doing is they're making masks. In the institution that I'm closest to that I visited yesterday, 3 masks have been passed out to every person that was inside the institution already. It's mandatory that staff wear masks. And so like I said, I posted pictures of being in the warehouse. The guys that are doing time, they have masks on. The staff, everybody was wearing masks. So we've also been in close contact with the Secretary of Corrections and having ideas of how we can help. And part of the things is donating things like soap, just figuring out unique ways to make sure that there are enough supplies, because they say you should wash your hands. And as most of you know, matter of fact, as all of you know, you usually get 1 bar of soap a week when you're inside. And usually if you're gonna wash your hands, bathe, and wash your clothes, that bar of soap is not gonna last. So we figured if we were able to just get more and more soap to put in, that would help. Now that's the Department of Corrections. They're looking at some more releases from what I hear. I haven't heard officially what they're looking at, but we're still pushing it from an advocacy standpoint with organizations up and down the state, including the ACLU and others. Now, the county is an entirely different beast. California has 58 counties, so that's 58 sheriffs that make the decisions, and LA's county is the worst. He has claimed that he let people out, but and that our top, which was 17,000, is now 14,000. Wow, 14,000 in county jail. Yay. Okay. There's still not enough space in those county jails. Like those county jail cells were meant for instance, a person that's in a 4-man cell. You have 6 people in the cell. There's no way for you to be able to do social distancing. But there's some lawsuits that have been filed, especially in Inland Empire, which is part of in Riverside County also, where 2 deputies have actually died from COVID-19, but they're also bringing people back in for like technical parole violations, which is not supposed to be happening. It's not supposed to be happening based on our judicial council's recommendation, which is a bunch of judges in the state of California that says stop doing this, but sheriffs aren't following their guidelines in some of the counties. So there are multiple lawsuits that have been produced for that. The last point that I just want to share in terms of what we've done in California, when we talk about advocacy, like I think there are 4 parts when we talk about ending mass incarceration. Just my personal opinion, based on what I've seen on the ground, going inside the institutions for the past 8 years. So one, of course, is policy, making laws that are more fair, that are fair to everyone. 2, when people are inside, they really need to be able to continue to focus on education, as we call it, rehabilitative programming, therapy, all the things that's necessary to help a person be able to hit the ground running when they get out. That has to be robust inside institutions, and a lot of it should be done by people that have been there before. 3, a robust reentry model where people can come out, not just get a job in a warehouse making minimum wage, but where they can actually get a living wage. And the last part, and that reentry model should include everything from the trades, college, you name it, whatever person needs to get where they need to go and live their best life once they're released. The last part, to me, of ending mass incarceration is definitely stopping the fuel that fuels our system, which to me is our children. It might sound cliche, but ending the school to prison pipeline is part of it, because if you think in terms of a big fire, you know, we have big fires in California, burn up everything. What firefighters do is they cut a break in the fuel. So when this part is burning, they cut a break so that the fuel no longer burns and the fire goes out. If we can stop our kids from matriculating, from going into the juvenile system, or matriculating from the juvenile system into the adult system, those 4 parts are necessary to end the mass incarceration, in my opinion. And to do those pieces, we have to be in different positions, not just in policy-making positions. For instance, in California, we have what's called the Board of State Community and Corrections. They basically lay down the rules and regulations for all of the prisons, but they also dispense funds throughout the state that come from savings like Proposition 47. We sit on some of those committees. And when I say we, people that are formerly incarcerated. Now, this just started happening maybe 5 years ago. Before, it was primarily made up of law enforcement. The first time I sat on the executive steering committee, I was the only formerly incarcerated person there. And there were probably 6 sheriffs, probation, and parole. And I'm like, wow. But that's grown. And we've just had the first person that has been appointed by the governor, Norma Kupian, to the board as an official board member for the Board of State Community and Corrections. That's huge because it gives you a few things. 1, you see where the money is coming from. 2, you see where the money is going to. 3, you actually understand how the money is allocated. Like, why is it being sent there? There's so much to it. The other thing, we sit on a few other boards throughout the counties and the cities. And once we learn that these are decision-making parts, because, for instance, our juvenile halls, we're sitting right now in LA County, we have 2 formerly incarcerated young men that were once juveniles. And they're in the policy-making process on this board to determine where should juveniles stay in probation, or should that stay under probation, or should it be under the Department of Health? And so being able to have their voices heard is shifting how a lot of things are being done. For instance, one of the things that shifted, they would no longer use pepper spray in any of our juvenile facilities. So the power of that comes from sitting on these boards. True enough, we do need to make sure that elected officials are held accountable, but we also need to make sure that we're sitting on these boards in the city and county level. It's where the money at. It's where the money is at. That determines how, and you determine how the money is being spent. Because if the money is not being spent to help our people, then that only means one thing. The money is being spent to keep our people in there. And if we're not in a decision-making position on those boards, that money will continue to be spent that way. Like, literally, I was told when I first came home, when money is allocated, whether it's from the state level or the federal level, follow it. Find out where it goes and who makes the decision on how it's spent, and figure out how to get involved in it. And once you're able to do that, you literally, like, to me, the local level is where most of the power is at. State and local level. Like, I know federal level, there's a lot to do with that, but when we watched how we've been able to decrease the number of youth that are in our facilities in both the county and the state, that came from direct advocacy and sitting on some of those boards. Again, like earlier I said, we co-sponsored and helped pass 17 pieces of legislation in the last 7 years. We continue to push those pieces of legislation, literally building relationships with policymakers on the state level, both assembly persons and state senators. In the last 3 weeks, we've actually interviewed the chair of the Assembly Public Safety Committee, who will tell you he does not want private prisons. I'm not going to fund private prisons. I'd rather fund schools. He will say that publicly, and he will vote that way. Our senators, like, I literally have, like, Holly Mitchell, have the utmost respect for when there was an attempt to roll back the changes that we had made for youthful parole or the youthful parole guidelines. She got up from her seat on the decision-making committee in the Senate and got up and gave public comment in support of us. And so when you see a public official that's willing to stand there, not just say it, publicly say it, and then vote for it, those are the type of people that we need to do a couple things for. One, when they need, like, I have to take my ARC hat off for this part because we don't have a C4 yet. So this is Sam Lewis, just the guy that did 24 years, not the executive director. When people like Holly Mitchell, Reggie Jones Sawyer need help being elected, guess what? We need to be out there knocking on doors, phone banking, and doing whatever else is necessary. And that's across the board, whether it's California, New York. We need to make sure that the people that support us have the type of support from us. And you know what I mean? Because if we don't get out there and we don't vote for them, and we don't get our families to vote for them, we end up getting stuck with some of these people that don't represent what's best for our communities. We've been pretty successful in changing those laws in California because we've been doing those things. And you know, they say California is a blue state, but it's kind of like, it's kind of a purple state. And I say that because everybody's not progressive that's a Democrat. I just said that with majority, we have the majority of Democrats, from our governor, lieutenant governor, all of our state legislators. But that does not necessarily mean that they want to see people coming home from prison. The last thing I want to say is in terms of what people call violent offenders. I hate using that word offender, but that's the term that people normally use. In the last 8 years, over 6,000 life prisoners have been released in California who historically had not been being released. Of that 6,000, the recidivism rate is less than 1%. Less than 1%. Every one of those are violent crimes that people, including myself, the recidivism rate is less than 1%. So when we take into consideration of like, who do we, like when people say, well, we don't want to look at people that have been convicted of violent crimes. If they've done the work and they're prepared to come home and they are the best ones to bet on, why not release them? Why wouldn't you release them if they have the lowest recidivism rate compared to anyone in any state? Like lifers, people that have done long stints of times, and I'm certain this is true in all states, have the lowest recidivism rate, but we're not putting that out there enough. Like, look at the number. Math doesn't lie. It's the truest science there is. If that's the case, then we need to be pushing those numbers, because two things happen. One, we bring that 54% of the population that are currently incarcerated into the conversation, and we make it a real conversation and just say, instead of just saying, yeah, that's great, we're making a conversation that says, you know what? These are people that we want to bet on. And the reason why we want to bet on them, because they normally win.
So just really quick, we only got 30 minutes left. So I want to give you all this caveat. We got a couple of people on stack. I really got to ask y'all to just spend 2 minutes to say what you got to say, because we got to get to some solution. We talked about all these resources we got access to and the power of our collective action, and we definitely want to get to that part. So in the last 20 minutes, in the last 30 minutes, we got James, we got Hakeem, and we got Sean, and I apologize, right? But can y'all just give us 2 minutes real quick, and then we're gonna jump off and talk about solutions, how we could use our collective power. So James?
Yeah, thank you, Ruben. Yeah, here at DPN, Dignity and Power Now in Justice LA, our latest recording was the count in the county jail was 17,000. It's down to like 11,900 now. And with actually 44 confirmed COVID cases and 1,700 quarantine, right? And, here in LA, it was kind of like a little different from our other folks around the country. And that's because the most recent jail fight that took place here with Justice LA and 30 other coalition partners, right? Because here in LA, they was already to transition into alternatives to incarceration. They was already ready to start decarcerating, right? Sending folks to alternatives instead of incarceration. So I think that's why we was able to move a little faster than others, even though because we still the biggest jail in the world, we still haven't moved enough. We still got a lot other folks that we need to reach out to. So that's why this work gonna be continuous. Sam Lewis said, follow the money. And somebody else said something earlier, I lost the train of thought, but yeah, follow the money, right? Because the money was set up when documentary 13, what they was talking about, that's when the money trail start, so this here is just a continuous of what our ancestors went through. That's why we the most impactful or the most marginalized when it comes to everything, right? But again, though, here with this recent jail fight in LA, we are following the money now. We are now getting that $4.5 billion reallocated, to people in our communities. that's already been rendering the service that these county officials and state officials too, that's been getting paid for to do, but our people haven't been getting the service that they need. You know, so that's just some of the things that I wanted to talk on. And then another thing, you know, we just try to be there for our folks at this time, you know, because was nobody ready for this, but we know that we have to continue to have this work going. And as an org, you know, we look out for our family members and members too, as far as just making sure that they have the things they need, you know, baby wipes, diapers, formulas, and stuff like that. And another thing is, you know, here in LA, we've been having sheriffs and other folks that's willing to do releases. But now when we have problem with folks doing their job as far as releasing, now when I'm talking about the judges now, right? The judges been not wanting to release nobody. You know, again, they rather see people sit in jail and die. You know, when they know that people can't social distance, people, it's not getting the adequate things in there. You know, again, that's another reason why, you know, SB 10 is bad for us and our people. And another thing is this, and here in LA too, Justice LA will be filing a lawsuit today in behalf of men and women that's locked up in these cages in LA County jails. So I know we're short on time. I just want to throw that out there. And we do need to connect and share info. Thank you, bro.
No, I appreciate that. I'm gonna send an email with everybody's email address and phone number after this. Because one thing, like I said, we want to focus on is COVID relief. We know the mass incarceration, the bigger picture is work we're doing every day anyway. But in the middle of this pandemic and trying to save lives, we need to be able to drill down on how specifically we can get that done, because there's a sense of urgency, right? Some stuff can't wait for 2-3 weeks or a month down the line. We got to be able to move now and act quickly to get people, you know, out of these death camps. So I think we have Hakeem next and then Sean.
Okay, definitely. I try to be as brief as possible. I think in the state of Michigan, one of the things that has really, really intensified the work that we're doing here is not the fact that at one point in time, just a couple of days ago, Michigan was the hotbed with the highest rate of infectious diseases of COVID-19 in the nation. Just for a couple of days, a brief period, and other states have now eclipsed it, et cetera. But what it did for us, aside from the fact that we have almost 30 deaths in Michigan's prisons, 28 right now, we have some of the highest numbers of infectious rates. Of course, some of our prisons have 70% of the population is COVID-19 positive. But what it has done for us in the work that we're doing, our coalitions and our campaigns here, is has really intensified the reason why we started an organization here in the state of Michigan called Nation Outside. Nation Outside is similar to Just Leadership, an organization really founded by, created for formerly incarcerated persons to organize themselves legislatively, you know, socially, politically, economically, and regionally in order to really fight for, you know, social and economic justice for persons with criminal histories in the state of Michigan. This organization, its drive is to really show the power of formerly incarcerated persons, the power they have, because here in the state of Michigan, the day you're released from prison, whether on parole or not, your right to vote is returned to you. Now that has created for us in the state of Michigan, what Nation Outside's motto is this: we have one of the largest voting blocks in the state, the largest voting blocks in the nation, formerly incarcerated persons who have the right to vote. If we organize that voting block, we're going to be able to impact who gets elected at the state representative level, at the state senator level, and our local elections, our county commissioners, our city council, our mayors, our judges, our school boards. We can decide that if we organize and mobilize our voices, formerly incarcerated persons, with the power to vote. Now, what that requires for us, of course, to do is to really create a really serious political body. Not necessarily a Republican body or a Democratic body, but we have to form a universal consensus of what are our issues that we're going to advocate for that impact us, so that we can, in fact, impact the systems at play. Now in Michigan, I've been fortunate to be the first and only incarcerated person, a formerly incarcerated person, appointed by a governor to a state commission to a 4-year term. Not a task force, but an actual state commission. That makes me the only a formerly incarcerated person in state government right now that's been appointed that is a currently justice impacted person. I'm currently on parole. I've been on parole for 14 years, right? Since getting released from prison 14 years ago, after having served all that time for wrongful conviction, I'm still on parole and I'm currently in the state government. So that gave me a powerful opportunity to show how powerful our voice is. And that's one of the things we have to do is begin inserting our voices in these powerful places so that we can form enough stronghold of a political voice, a social voice, a constituency voice, who we represent as a people in our state. And we have the power to really change and make some differences. So we've made some great strides in Michigan. I could go on and talk about specific nuances and things of that nature. But from Michigan, the voice that we have as Nation Outside, I urge you all to formalize some form of universal voice. Instead of just working for organizations and doing the work that you do for your own organization, go out there and form a whole entire universal block in the state that you are in to form a voice, to have an impact in the state for advocacy campaigns that we're fighting for.
Perfect, thank you for that. I want to get to Sean real quick and talk about something specific, because when we talk about this COVID pandemic and the quarantine and people being furloughed from work and can't pay their bills, how does that impact men who are paying child support? If you're involved with any type of custody situation or you know, some guys aren't even seeing their children if they're in different states or different cities because of travel ban. If you've been furloughed from work, obviously the state still want that child support, but how do you deal with that? And how does that impact folks during this pandemic? Sean. We can't hear you, Sean. Sean.
Got you. That's a good question. I think first and foremost is you know, man, you know, the most, you know, the ones amongst us who are struggling the most are the ones most impacted by this. And so, for example, you know, the high unemployment rate, many of the fathers that I know are being laid off or just unemployed from their jobs. But even to that, so this government relief package that's out, you know, the stimulus package, I don't know if you all are familiar with this or did y'all know this, but if you are behind on child support, then you don't get that stimulus check. And I know some people would argue, well, they don't need it anyway, you know. But I would argue that most often when we think about non-custodial parents who are behind on child support, you know, we got this image of this father out in a convertible and got a trophy wife, but a lot of times it's a father who doesn't have the money to begin with. And I say father because while the stimulus package or the stimulus check wasn't going to non-custodial parents as a whole who were behind, we know that the ones who are most impacted by that are fathers, and even add to that fathers of color. So I just want to put that out there. That's a real challenge that I'm seeing. And I think that when you have this real brief glimmer of hope in the form of a stimulus check, and you realize you're not going to get it, I don't think that helps the situation any. And then two things. I was just thinking about what I was hearing in this conversation. I wrote me some notes down. One thing I just wanted to share, in our local jail houses 1,800 inmates. And in the first time in about, I want to say at least 7 years, we're actually down below 1,200 inmates in the jail. So I just want to put that out there. I mean, the first time like 7 years, normally we're at like 1,900, 2,000. So, you know, for that, I think that's a big plus. And the other piece of that, why I bring that up is because if you think about their ability to release folks now, then the question you have to ask yourself, why weren't we doing that before this? Why weren't we doing that before this pandemic? And then finally, earlier too, I think Ms. Johnson started out with this, you know, talking about the inadequate numbers, testing numbers. You know, here in the city of Louisville, Kentucky, I don't know if y'all know this, but we were on the news about a month ago, right? And we were on the news because of the limited number of tests that folks were coming into our community charging $200 for fake tests. So when I tell you that, you know, this type of situation brings out the worst in people, I believe, and sometimes, and then on top of that, those of us who are the least fortunate seem to suffer the most. I tell you what, this is a prime example of that. Like I said, $200 and they were fake tests. So anyway, I want to put that out there. And if I don't get a chance to say anything else, hey, Ruben, I appreciate you for putting this together, JLUSA, and the rest of you for being on this panel. Man, I thoroughly have enjoyed what I've been hearing today. I thank you, and thank you all for the work that you're doing.
Definitely. This is just the building block, so we just starting. So what I want to do is shift. We got about maybe 15, 20 minutes left, just to talk about some solutions real quick. I know before Sam got off, he talked about organize a voting block, which is really powerful. I know Salim and Bobby probably want to speak to that. Organize a unified force of formerly incarcerated people. I know earlier we talked about collective resources. So does anybody have an idea around how do we address, and I want to make it very specific. We're all working to decarcerate, we're all working to serve our people in every level of incarceration, county, state, federal detention, immigrant detention center. So we got that. We got about 15 minutes to talk about this pandemic. What are some of the solutions we can work through collectively to build towards supporting our communities, getting people released, and getting resources, whatever resource needed in our community? So,
if I may, and you can put my 2 minutes.
I was putting you on the timer, Nicole.
Start my clock.
Clock is running.
The first thing is ensuring that our folks have housing support. So working with the local hotels and getting the funding in terms of making sure that we can provide at least a few months, 4 or 5 months of housing for our people. The other thing we need to do collectively is get in front of the narrative. We are getting massive people out. And if we don't ensure that we control the narrative around people getting out and being successful, what is going to happen post-COVID is the reason why they're going to assume that they need to lock our folks back up is they're going to start putting stuff out in the media that our people are reoffending and it was a mistake to let people out. And so we got to start sharing the successful stories of our folks being released at every opportunity that we can. We have to control the narrative. And I think the rest of you will say some things that, I will wholeheartedly agree with. But in terms of solutions, housing and the wraparound support is needed, making sure that our people get mental health support, therapy. We need the Black therapists more than ever to talk with our loved ones and talk with our folks that's coming out of those prisons and jails because they've seen some really messed up stuff in there. And so controlling the narrative, housing support, and mental health therapy.
Absolutely. Appreciate that. I think I saw Bobby's hand. And then
Ruben, Ruben?
Yeah. Okay. Val, we have Bobby, Vidal, then we go get you, okay?
Okay. All right, thanks.
Bobby?
Yeah. Regarding the solutions, I like the hand sanitizer. And my thing is this. I want to say this. This is Bobby speaking. Me. One thing that I think is important for anybody that's in this field, lobbying or advocating for ending mass incarceration, the segment of our people that we represent that's directly impacted, then we need to pull those resources. If we can actually purchase, some type of supplies and compel the Department of Correction in any of these prisons to accept that hand sanitizer, because in Pennsylvania is on the ban list. So if we could compel them with some strong lobbying, well, we're going to make sure that the individual lives inside those prisons are protected and safe with whatever measures or means. Then that's an opportunity that we have to do, directly impacted people. For those that's not doing it, I don't speak about them. I'm speaking about us that's directly impacted. Another thing, when it comes to the masses, there's resources. Not many out here. You have like we have in Philadelphia. We have Grown. That's Donnell Drinks and them. They're providing free face masks to people in the community. So that's a resource that we on this panel, as well as the viewers out there, we should look at connecting where as though here's a formerly incarcerated individual providing free masses to the people. But why not make that transition into the penitentiary? Let's, pull that resource and say, what, Department of Corrections, we're going to do this and we're going to bring the masses up into the prison by supporting another, directly impacted person that cares about it. I like to always say, love is an elevation of understanding. These folks that's in elected office, they don't love us because they don't understand us. We're perceived as the property of every state. We're not Black to them, we're the property that's Black, that belongs to them. So why not separate and declare our independence by fighting the way we fight? And I have to stress this about when what was that brother Sam made mention about that resource on the political thing, you know, by getting and supporting, you know, different politicians that support us. Yeah, they do. Some of them support us with selfie mode. I'm not for the selfie mode with the politicians. Why not we go in on as directly impacted people? We pull out resources and create our own political hub that teach and train the individuals in our community how to be able to govern with the policies that speak towards us and address us. Like we say, nothing about us without us. Well, this is something that we have to consider as an option that's mandatory. In the city of Philadelphia, right now we're doing, as you alluded to, Ruben, with, you know, Salim and Donnell Drinks and other formerly incarcerated along with yourself. We're talking about unifying that 460,000 individuals in the city of Philadelphia. That's a voting block. We can dictate and control any political election in the city of Philadelphia because we have the ability to vote. So now we're mobilizing to assert that. And it's time that we look at it as this. It's time that we, you know, really look at it. We're not asking, we're demanding. You know, I like to say how Deanna always share with us, we make bold stands and bold move. That's a bold move. We run and dictate to them because they're not acting on us. So move them out the way. Think about that, creating our own political hub to teach and train our people how to run for political office with an agenda that's geared not 90%, but 100% for Black and brown people, because we're not represented with love from these individuals in these offices. That's what I had.
Absolutely. Vidal. Did we lose you, Vidal?
I said I wanted to share this with people because I think it's important for people to kind of see this. Can people see?
Yeah.
Yes.
Yeah, I wanted to really share this with people because I want to tell people that we should be using all platforms, Instagram Live, to get people, the younger generation, really active in this. There's a voice that's being left out of here, and making sure, I'm sorry if I confused the part, but there comes a certain part where Governor Cuomo is not actually said 1,000, 100 people to be released, and he narrowed the list so small that no one can be released. I think it's important for us to use all platforms, Instagram, op-eds, for our story to control the narrative. I think we need to start making sure that we really push on our governor and our mayor, other elected officials who are powerful by creating, with us, we're doing the Freedom Now, where we're showing pictures of individuals who are incarcerated there, because now the governor and the mayor has to see the faces of people when he decides what exactly the decision of people's life. So that's a real important part, to make sure that we're organizing and also humanizing, so people know who are the individuals behind bars, and they know that people have loved ones out here that really loves them. I think the other part is, as you know, partners, pushing partners to do lawsuits. I think that's a real important part. In New York City, we're still keep pushing to decarcerate. And the most important thing, the mayor has shifted his budget to reflect investing more in police. That has to stop, and we're shifting. And the last thing is making sure that Governor Cuomo and politicians who recently our bail reform that we won in January, that estimate that there's going to be 9,000 people who's going to be freed, just recently got rolled back. So that will actually incarcerate more people. So we have a shame campaign that we're doing, making sure that we're putting on Governor Cuomo and other elected officials. Even elected officials from my district voted to cut Medicaid, to not fully invest in our school system, but also do rollbacks. So I think the most powerful thing is use every platforms that we have, op-eds, to write our own stories and control the narrative. And the most important part for all of us is just keep organizing people.
Got you. Whose hand is up next? We got a couple more minutes left. Solution.
No. I think Valerie was going to go. I can go after.
Oh, I'm sorry, Valerie. I'm sorry. My apologies to my sister.
I didn't know how to raise my hand on here, but that's fine. I want to say this. I thank everybody. I was, writing a lot of stuff down. I'm not mostly like with the political part of it. But with the solutions that I do on practical things, I have over 12 people who call me from the state institution and from the county, because I'm in the county, teaching in the county, and wanting to be there for them, meeting their needs. You know, some of the solutions that I do, as knowing the women that who are locked up, they're worried about their kids. You know, and me reaching out, like saying, well, what can I do? You know, whatever it is, whether I could buy them a gallon of milk, a loaf of bread, make sure their kids got boots and stuff like that, so that, you know, they ain't worried like, oh my gosh, you know, my kids already feel forgotten by me. These are some of the solutions that I definitely, why we was on this call, somebody just dropped off 6 bags of clothes for me because 2 of the women got let out this week, you know, and, you know, making sure that they got employment, making sure that they have a place to go, making sure they got deodorant is like so huge for me. Like that's the kind of stuff with the solutions. I know I can't do everything, but I can do something. And I like to, you know, write them while they're in there, accept their phone call, pray with them. You know, if I could be there with their kids, like that's like, you know, just saying your mom has not forgotten you, and whatever it is that their kids might need, like these daily needs, basic needs, a mom thinking that their kids ain't getting their basic need met is enough to hang it up while you're in there. So like, these are the solutions that, you know, practical things that I like to do, you know, to do something, to pain shared is pain lessened. And, that's, you know, that's what I want to say. There's some of the solutions: employment, deodorant, shampoo, transportation, you know, a support system, a prayer partner, stuff like that, and making sure that the kids' needs are met. And I also have a team of people that are older that like to help mentor the children academically. You know, so that because not having a parent is going to mess with you in school, you know, so stuff like that. I'm grateful for everything. Nicole, I'm going to tell you something. Nicole, you was giving me chills all through my body. I was writing down some of the stuff you were saying, you know, like everybody on here, you know, we're doing something which is amazing, and I'm just grateful to be a part of this.
We're gonna stay connected, Valerie.
So I know we have a little bit of time left, and I have 3 things that I want to leave on. And the note that I want to leave on is echoing the voice of Andrea James, who is the executive director of the National Council of Incarcerated and Formerly Incarcerated Women and Girls. What we always say is that as directly impacted folks, as formerly incarcerated people, we cannot settle, and we must educate ourselves on the issues and the things that are going on. Trust and believe that that our opposition is going to use this time to give us the crumbs, and going to use this time for us to accept home monitoring and to accept all these things that we were fighting from in the beginning. So we cannot accept those. We have to continue to rise up and fight our issues as we believe them, you know, to be true, and not to settle for what they want to give us. The second thing is to our funders. For so long, and being a new organization in this, as first thing I heard was, oh, we can't do direct services. We can't give you money to fund direct services. Well, now look, we have funders that are contacting us and telling us, hey, look, can you all do direct services? What can you do? Don't allow the funders to go back to that pre-COVID mindset, and let them continue to tell. Direct services has always been an issue. We can't expect our people to do anything if they're hungry, if they're not fed, if their needs are not met. So we can't, we've been telling them this for a long time, for at least the last 2 years. I've been telling funders this. And so with that being said, create a mutual aid in your community. Don't let the COVID time come and go and you have not created a pod, a community pod, and know who your neighbors are. Mary Akaba has a very good training around pod development, so that you can know who's around you, so that the next time we have a crisis, we won't be so below the bar and trying to galvanize our community. And the third thing is, I believe that the COVID is the mass liberator. We've been trying to liberate and do things for years, and the COVID came over and almost overnight has depopulated the prison, has let people be free, has told judges that what they had to do, etc. Just don't let folks go back to pre-COVID. We have to make sure that these demands demands that we have put forth, and demands is what they not request, not pleas and maybes, but these demands that we have put forth, these decarceration demands that we have put forth on our states and our jurisdictions must continue past COVID. We cannot allow them to go back. So those are my 3 inputs on what I think that we should do, and do not allow them to take us back to a place pre-COVID.
Thank you for that. So we right up on our time to end this. What I will do, I'll make some notes of these solutions and some other ideas that we share with each other. I'll also put out an email or contact list with everybody's email and phone number. We could convene a private call to kind of continue to build for those who are interested in that. So I'll send out the email or reach out to you directly. But the one thing I do want to leave on is we cannot drop the ball, right? We can't drop the ball for a number of reasons, but the sense of urgency being number 1. But number 2, like we've seen this before. It may not have been COVID, but we've seen this kind of trauma inflicted on the Black community before, on the brown community before, on marginalized communities before, on incarcerated people before. And because there's this ebb and flow, what the opposition is good at is distraction. They're good at making you get comfortable and forget about the urgency of your own existence, right? The urgency of your own survival, the urgency of your own people's liberation. I like how you frame that, Kiana, because I agree. We've been fighting for decarceration for years. And within a month, we got 900 people out of the county jail, 86 out of the state prison. And obviously we know those numbers are nowhere close to what we're shooting for. You know what I mean? Just literally scratching the surface. But guess what? Don't take that for granted that it was your organizing skill, your advocacy, your energy, your time, your sacrifice, your commitment, your contribution that made that happen. So we want to just continue to push and not drop the ball, and don't let this be just a moment. So I thank you all for your time, for joining us today. I will be in touch to follow up with you. And I just urge you to keep pushing.
All right. Thank you, Ruben.
Not at all.
Peace, y'all.
Thank you. Black Fist, you know what it is, Rube.
Black Fist. Hey, man, I'm going to call you in like 10 minutes. Let me go get something to eat real quick.
Don't call
Then
me.
we got to.
Don't call